There are two main forms of allergy testing that are used broadly around the world. These are firstly skin prick testing and secondly blood testing using a marker called specific IgE. To go back to skin prick testing, this involves droplets being put onto the arm or anywhere else in the body if the arm is not suitable. However, it is important to have made sure that you have not taken antihistamine for the previous 5 to 7 days before having this testing, since this will negate the effectiveness of this form of testing, in which case your practitioner might suggest blood testing as first line. The skin prick testing involves drops of extract put onto the arm using initially positive and negative, positive being histamine and negative being saline, and these are pricked with a lancet, which is a small sharp object which does not break the skin. Skin prick testing involves putting a number of droplets onto the arm or other parts of the body depending on what is available and free of eczema. It is important to remember not to take antihistamine for 5 to 7 days before going to have your skin prick testing, otherwise your doctor would recommend to have blood testing in the first instance, because the reliability of results after taking antihistamine within a week are less effective. The skin prick testing involves putting drops of extract onto the arm and pricking them gently with a lancet in order to see whether we can have an immediate wheal response, which would inform you that the child may have a sensitization and possibly an allergy to that food. The skin prick testing would involve whatever foods that you felt your child might be allergic to, and if the food is slightly less common, it's important to bring the food with you to your allergist or to your doctor in order that they can use the food itself to do what we would call modified skin prick testing. With cow's milk, we use an extract in the first instance and also raw milk as well in order to compare and see whether either of these might cause a reaction. The results are available in 10 to 15 minutes and therefore would enable your doctor to give you an immediate answer as to whether they think you had an allergy or not. The other form of testing is blood testing, which involves taking a blood sample from your arm from a vein. The good thing about blood testing is that it does not matter whether you've taken antihistamine recently, and this enables you to have the diagnostic test performed at your first doctor visit. The blood tests often take 1 to 2 weeks to come back, but will give a wide variety of information to your doctor in order to help diagnose whether you have cow's milk protein allergy or not.